if a person comes in here and they're depressed and just really not feeling good, difficulty getting up in the morning, I will prescribe an antidepressant. I have nothing against that. But I'm going to try to figure out why they're depressed. What are they depleted of? Or what do they have too much of? Or what is going on? Is it maybe chemistry or hormones? Or is there something going on in their lifestyle? Is it stress? Stress is a big factor. It will drain us of our energy and thus affect our hormones and our neurotransmitters as well. What does this particular patient need at this particular time in their life? This is important. If we need to prescribe an antidepressant per se, or we got to get the blood pressure down as real high, I will prescribe an antihypertensive. I have no problem with that. Thank goodness we have these things. But again, let's find out what's going on with them that is causing this. A lot of times people are put into what I say like a diagnosis bucket. The diagnosis bucket is really symptomology. For instance, things like ADD, ADHD, chronic fatigue syndrome, fibromyalgia, all of these things are really symptoms of things. But we have to, because we're in medicine, we have to label things. So I have people that will come in, they'll say, I'm chronic fatigue syndrome, and they become identified with, I'm ADHD and all this stuff. The identification process, I make them aware not to identify with that. That's not who you are. But these are a host of symptoms that we have to look at to get to the root cause of why is that happening. Is it your thyroid gland that's causing some of these symptoms here? Is it a poor ratio of estrogen to progesterone? Is it a lot of stress in your life where your adrenal glands are no longer producing as much cortisol that you need to handle stress? What is going on? I'm very thankful that I can prescribe medication to help people along their path until we can get to the root cause and maybe use other things, for instance, whatever, homeopathy, acupuncture, uses of botanicals, change of lifestyle, counseling in decreasing stress and stress management. So I'm really glad that we can combine the best of both worlds for that individual at that particular time in their life.